Hello all, I hope you all are doing great. This is Dr. Fathima. I'm a clinical pharmacologist and an expert coach in pregnancy and parenting. Welcome to our channel 9 Mantras and thanks for being part of our mission to educate million moms and moms to be. We have discussed a lot on pregnancy first, second trimester, and now this is the time to discuss briefly on third trimester. There are so many questions, so many doubts asked on third trimester. This is a phase where each and every mom to be is excited to the core, right from baby's gender till baby's health. There are so many things that they would like to know about baby, and this you get to know in various ways. So we will just discuss few of the points which could be concerning for you during your third trimester and how you can overcome, and I'll also give you some tips and tricks. In pregnancy, third trimester especially, you feel like urinating multiple times. This is because your baby is growing bigger, and it's like your baby is sitting on your bladder, due to which you get to feel that pressure to urinate multiple times. So I'll give you a small tip. It doesn't mean that you should reduce your water intake and all. It's a big myth. I have seen people saying that I don't want to drink much water because I'm going to urinate multiple times and it is very hectic for me to do it. See, keeping yourself well hydrated is important to improve your overall health. So for this kind of situation, what you can do is you can drink good amount of water, at least 3 liters of water in a day. But see that you're not taking too much of liquids or water when you're about to sleep or just before you sleep. That is something that you should take care of, and you have to take few sips of water whenever you feel thirsty. It shouldn't be like, okay, now I'm done with my water intake, now I'll not drink any more water. No, drink water. You might as well see back pain. It's very crucial to sleep on your left side. During the first trimester, it's up to you. Comfortably, you can sleep. Second trimester onwards, you need to sleep on your sides, preferably on your left. When it comes to your third trimester, try sleeping on your left side, because when you sleep on your left side, the blood circulation goes good to the baby. There won't be any sort of obstruction with respect to the blood flow. Some women often complain swollen feet or ankles. This is because of the extracellular fluid getting accumulated in the lower extremities. Especially when you are standing for longer time, when you are sitting hanging your legs, then you can see swollen feet. The best thing to do is to keep yourself well hydrated, keep your legs elevated. Don't always keep your legs hanging. Okay, whenever you are sitting or sleeping, just see that you're keeping your legs elevated right from your knees onwards. It shouldn't be like you're just elevating your feet alone. If you're doing like that, you'll suffer with knee pain later on. There are so many changes happening in your body, and the symptoms that you used to see before, it's not like they are going to leave you, right? Especially with respect to gas issues, bloating, heartburn, and indigestion. What you have to do is to eat in small portion multiple times, not all in one go. Just stay away from all sorts of junk, oily food and all. That's the best thing you can do. And this is the time, right from your 8th month onwards, some women may get afraid of the contractions. You should understand what is true contraction and false contraction. You should also be aware of the Braxton Hicks contractions. These are nothing but the false contractions. So these happen because your uterus is getting ready for the D-Day. So before that, these trial sessions go on. So do not panic, but do understand how these false contractions will be. For example, if we have to talk on the false contractions, these are not regular. The word itself says false contractions, means this happen at any time. These are false. This happen at any time. They come on their own, they go on their own. There is no rhythm, nothing. Sometimes you don't even realize. But if in case you see lots of tightness, pain, discomfort, then just inform your doctor. We all are very much worried of our skin, right? We want to look flawless, beautiful in and out, right? But pregnancy is a phase. It doesn't leave us the way we want, especially when it comes to stretch marks. Every person is different, their body is different. Some women find stretch marks over their tummy, over their breast. arms, thighs, calf muscles, because this is where the stretching happens. Our skin has got that property to stretch. It stretches as much as it can. Later on, stretch mark happens when this goes beyond. That is why we get to see stretch marks. But there is something that you can do to prevent the visibility or to minimize the stretch marks. There is no magic remedy when it comes to stretch marks. Please understand this fact. You might get to see so many products promising that this is the overnight thing, this is how it would work and all, but nothing is going to work. But yes, you can minimize the visibility if you are taking care of yourself. One best thing to do is to drink good amount of water, and you can apply some coconut oil or some moisturizers. When you nourish your skin, you're making it better. Okay, you're protecting it from excessive stretching. You're protecting it from preventing the marks to happen. So basically, you need to nourish the skin. Stretch marks, they do happen. The severity varies from person to person. Some women would see very light stretch marks, whereas others would see lots of stretch marks. So do not worry about it. And pregnancy is a beautiful phase. These are nothing but the trophies that we get when we are pregnant. And you might as well see various other things happening like constipation, headache. Again, it's all about handling your own self. If in case you see headache, blurred vision, just inform to your doctor. If you are suffering with any of the issues like gestational diabetes or preeclampsia, ensure that you are consulting your doctor as per the schedules. Take the medication, do dietary changes, don't have excessive salt, sugar, sweets. So anything in moderation in a healthier way is a good thing for you and your baby. You can do exercise. Okay, when it comes progresses further based on the person's issues and other factors, the prenatal yoga expert would say, like, these are the asanas that you can do at this point. Accordingly, you can do. If you are interested, definitely you can join this sort of birth classes or prenatal yoga classes, and you can enjoy doing them. It's all about keeping yourself flexible, happy. When you do this exercise, it's not only good for your body but also for your mind. Okay, so you can be active. Just check with your doctor if it is allowed in your case. In third trimester, when you are going forward day by day, when you get into 8th month, again 9th month, when your EDD is getting near, it's like you're in that anxious mode. You're confused, you don't understand when things would happen, you're sometimes stressed. Practice meditation, do some stress-free activities, speak to your friends and family, spend some good time with your partner. And this is for all the fathers to be here. Now your little bundle of joy is on their way. So take care of the mother, just see what all she would require, pamper her, show her what best you can do. When you're near to the due date, it's very important that you take care of yourself and don't ignore your prenatal visits. When your doctor suggests you to go for certain tests or scan, just ensure that you're going. There are various types of scans, like it could be any growth scan or fetal well-being or any kind of test. It could be your thyroid profile again, your blood sugars, your blood pressure, whatever be it, just go ahead with it. That's all, guys. I hope this video gave you some insights on third trimester. There is a lot to know on third trimester. We are not done yet. So in this pregnancy series, you can find so many videos on pregnancy topics. You can just check out our pregnancy playlist. And I hope this video gave you some good information. If it did, like, share and subscribe. And please share these videos to the moms to be who would require this sort of information. As much as possible, I'm trying to help you out. And for the people who are new, I'll be posting videos every Tuesday, Thursday and Saturday. So please turn on the bell icon so that you will not miss any of the videos. And for the people who don't know me, you can just check out my Instagram handle, where I take live session every Monday, Wednesday and Friday. I'll see you in my next video. Till then, take care.